What do you need to know to survive the first trimester of pregnancy? Hi, friends. I'm Dr. Natalie Crawford. I'm a board certified OBGYN and REI, and I'm a fertility doctor. That means I talk about getting pregnant and pregnancy and hormones and health every single day. Today, we're going to dive into why the first trimester feels so hard, what is actually happening in your body, and top tips for survival in the first trimester of pregnancy. Before we dive in, huge thanks for you being here. I appreciate your support so much. Please consider subscribing, sharing, commenting. We get a lot of these videos from the comments that you are leaving, the questions below, and on the community page. So thank you so, so much. And as always, my book, The Fertility Formula, has information for you that you can go learn more about. Diving into the first trimester, I want you to understand that the first trimester is starting immediately after ovulation. Remember that when you ovulate, you're already 2 weeks pregnant. So at the ovulation time, that egg has to be fertilized within 24 hours. So crazy. Fertilization occurs in the fallopian tube, and then that embryo is going to grow and develop until it enters the uterine cavity 5 to 6 days later. That is when it is going to start to implant. And immediately upon implantation, you sometimes can start feeling symptoms. So, this is when you are still thought to be in your luteal phase or the second half of that cycle. And this is where the luteal phase and early pregnancy are just one and the same. The reason why some of the symptoms of early pregnancy are so strong is that the placenta doesn't take over until about 10 weeks gestation. What is happening is the moment that pregnancy starts to implant, the pregnancy is going to come and attach itself towards the uterine wall. The pregnancy starts to make pregnancy hormone as soon as it starts to implant. And the pregnancy hormone is HCG, human chorionic gonadotropin, actually binds to the same receptor that LH does. And what this means is that that corpus luteum is now having an increase in stimulus to make progesterone. So let's imagine the brain would send out little pulses, corpus luteum would make progesterone impulses. But now you have a pregnancy. And HCG rises quite specifically in pregnancy. So the progesterone production is going to ramp way up. And this is why typically once that HCG starts entering your bloodstream, which is about 7 days after ovulation, about a week before you might start to miss your period, you can start to see some of these first trimester symptoms or these high progesterone symptoms. This can be extreme fatigue, headache, being really sleepy, a sensitivity to foods, to smells, aversion to certain foods, nausea, breast tenderness, bloating, and those are all from the progesterone. Now, this is all nuanced because if you're doing fertility treatments and you're taking progesterone, we're raising your base progesterone, and it can be really hard to distinguish what is the medication you're taking and what are your symptoms. And so I warn patients who are doing a transfer cycle or who are taking progesterone that you might feel these symptoms stronger, but that may not mean you're pregnant. It might be the medication we're giving you. But this is why some people feel symptoms before they even are going to have a positive pregnancy test. And if you feel those symptoms, it is typically from the high progesterone, and you can take a pregnancy test early. Another thing that can happen is as the placenta is growing in, which is an evolving process over this first trimester, the placenta is eating away at the side of the uterine wall and the blood vessels are growing in and latching together. And this is important because you might have an increase in spotting. And sometimes we consider this implantation bleeding, but sometimes it can truly form into what we call an SCH, a subchorionic hematoma or hemorrhage. And that can be something that can present as bleeding in pregnancy. Implantation spotting tends to be a lot lighter than an actual period. It is usually associated with getting a positive pregnancy test. If you are just having luteal spotting and not a positive pregnancy test, we are more concerned that it is luteal spotting. Is it progesterone deficiency, an ovulation issue, a polyp, abnormalities structurally? Something needs to be investigated there. But if you're having very light, usually it's pink spotting, and then you get a positive pregnancy test, that's most likely just implantation spotting from the placenta growing in. Bleeding in pregnancy should be evaluated though, because it can sometimes be a threatened miscarriage, a missed miscarriage, even an ectopic or a tubal pregnancy. So we all do take that seriously. And if you have bleeding in a positive pregnancy test, you should call your doctor. Now, once the placenta grows in, which is around that 10-week mark, we're no longer relying on the corpus luteum to make progesterone. And we tend to have a stabilization of a lot of these symptoms. And that's why morning sickness and some of the first trimester symptoms that are so bad tend to improve themselves in the second trimester. But often we are trying to just mitigate the symptoms to kind of get through the first trimester. Your body has a lot of built in protective mechanisms, and sometimes this food or smell aversion is to protect you from the increased risk of getting a foodborne illness. Remember, your immune system is down because it's allowing something foreign, the baby, to invade. You can be more sensitive and susceptible to colds and illnesses. We recommend pregnant women when they're traveling, especially wash your hands, consider wearing a mask on planes and other places. But also think about the fact that if your body tells you that's not something you should eat, you should listen to it. Morning sickness tends to be worse due to some of the progesterone changes on the GI tract. We have change in gastric emptying, but I also want you to think about it is worse when your stomach is empty. So try to have small, frequent meals you can eat. First thing in the morning, your stomach is empty. You'll often hear people talk about having crackers or having something they can suck on, a hard candy right by their bed. Sometimes sour things can really help people. I had friends who've loved Sour Patch Kids, Werther's Originals. For me, and I would have to get up and go operate a full day. Cold chocolate almond milk was what always helped me. A little bit of protein, a little bit of sugar, and it settled my stomach so then I could eat more food afterward. If your nausea turns into vomiting and you're not keeping things down, dehydration is a real risk. There's something called hyperemesis, gravidarum, HG. It's really serious. You might need IV fluid support. And so if you're finding yourself that your nausea is more than nausea and you can't keep anything down, please talk to your doctor about it. In addition, in general, medications for pregnancy, there are some safe medications in pregnancy, but we want you to use medications only when you need it. And certainly, if something has less research and studies behind it, we're going to be more cautious. This is very nuanced based on your circumstance. And so, if you have a chronic medical condition like high blood pressure, diabetes, depression, bipolar disorder, you should have a visit before you get pregnant called a preconception consult so you change your medications to be pregnancy safe ahead of time. This is going to relieve anxiety because you know when you get pregnant, you're already on the right medications. And we want to make sure you're taking a prenatal vitamin with at least 400 micrograms or mcgs of folic acid. Folic acid is proven to be stable enough to cross the placenta and prevent a neural tube defect. Other forms of folate have not been proven this. So we really want to make sure, even if your prenatal vitamin has folate in it, that you take an additional folic acid and folic acid form of at least 400 micrograms to prevent a neural tube defect. This is something ideally you take at least 3 months before pregnancy, but if you just find out you're pregnant right now and you're watching this video, start it right now so that you can do what you can. For the most part, I know, at least for me, I had multiple pregnancy losses. So the first trimester was filled with anxiety, and I kept thinking, once I get here, then I will feel better. But the reality is, I just had a new worry every time once I got to a new milestone. So it's really important to think about during this time when things are less certain, what should you do about it? Make sure that you have community that you can count and support on, whether that's your partner, your mom, your sister, a friend, a colleague, an online support. Have some way to share some of this anxiety because it is really real, especially if you've had a loss in the past. Ask your early pregnancy questions below. I know we need to talk more about bleeding in pregnancy and miscarriage and pregnancy loss, but what is it you want to know so we can cover it in a future video? Thank you guys so much for watching. As always, I appreciate you being here. You can get more information on the As a Woman podcast and check out Instagram at Natalie Crawford MD. And don't forget the fertility formula. Thanks, friends.